Hey there, everyone, and welcome to Living East Tennessee. I'm Kurjan Donovan. Well, around 10 million Americans over the age of 50 have a dangerous disease that increases your risk of heart attack and stroke, but half of them may not even realize they have it. Vascular surgeon Dr. Tonks with Premier Surgical is here to explain why people should be aware of peripheral arterial disease. Dr. Tonks, can you explain what PAD is?
Yeah, so peripheral arterial disease is a circulatory condition in which blockages in the artery restrict blood flow to your arms, legs, or intestines.
Oh, wow. And so who is most at risk then for developing PAD?
So, unfortunately, we see a wide variety of patients. The most common conditions that sort of lead you down this pathway are smoking, diabetes, elevated cholesterol, or unfortunately, just a bad family history.
That's really good to know. And what are some of those common signs then and symptoms that people should be aware of and that they can look out for?
Yeah, so some of the most common complaints we see with peripheral arterial disease is pain in the legs when you walk. There are many different causes of pain in the legs when you walk, but this is a fairly common source of that pain.
That's interesting. So you want to be looking out for that pain in the legs. That's one of those common symptoms. What about diagnosing this disease? How would you go about diagnosing it?
Yeah, so the first step is pretty much always a physical exam. A lot of times we don't feel as strong of a pulse in the feet as we would expect. We see loss of hair on the toes or lower legs, things of that nature. And then the more definitive tests are typically an ultrasound or some form of cross-sectional imaging.
That's so interesting. So once someone gets tested, of course, and they find out that they may have PAD, the next step then is treatment. What are some of the treatments then for peripheral arterial disease?
Yeah, so the good news is the most common treatments for peripheral arterial disease is simply lifestyle modification, smoking cessation, control of the diabetes and cholesterol, and exercise. Walking is actually the best thing you can do for this condition. It typically improves the legs quite a bit just with a structured exercise program, which we can help guide. Unfortunately, a fair amount of patients also need some form of intervention, which is usually a very minimally invasive procedure to improve that flow.
Oh, interesting. That's really good to know. Is there something specifically that you want people to remember when it comes to peripheral arterial disease?
Sure, absolutely. So, it's often a misdiagnosed or underdiagnosed condition. If you have pain in your legs when you walk, especially burning in the muscles and cramping that nature with prolonged exercise, come see us. We'll check you out and just make sure everything's squared away and help get you on the right foot.
I love it. So pain in the muscles, burning in the legs, something really to be aware of. For more information, where can people go to learn more?
Yeah, so visit us at premiersurgical.com or give the office a call. We'd be happy to help.
I love it. Dr. Tonks, thank you so much. And of course, for more information as well, you can head on over to
Thank you.
livingeasttennessee.com.